Venipuncture involves several important steps. Thoroughly understanding these steps will give you the confidence to perform this procedure quickly and accurately. Check the requisition form to determine the tests ordered. Gather your tubes and supplies. Typically, you'll need a syringe of appropriate size with a 21 or 22 gauge safety needle, vacuum tubes for the tests ordered, 70% isopropyl alcohol pads, gauze pads, a tourniquet, a safety transfer device, hypoallergenic tape, a permanent marking pen or printed labels, and a fluid-impermeable lab coat and disposable gloves. Introduce yourself and greet the patient.
My name's Claudia. I'm the medical assistant.
Put on a fluid-impermeable lab coat, sanitize your hands, and put on disposable gloves. To make sure you have the right patient, verify his identity using 2 identifiers.
Can you confirm your name and date of birth?
Yes, it's Rick.
Explain the procedure and obtain permission for the venipuncture.
Looks like the doctor wants to send some studies for your cholesterol and glucose, so I'll have to draw some blood for today. Have you ever had
Inspect both of your patient's arms and ask your patient if he has a preference.
Do you have a preference which arm we use?
I prefer the right.
Okay.
Help your patient sit with his arm well supported and straight in a slightly downward position. Assemble the needle and syringe. Attach the needle firmly to the syringe. Pull and depress the plunger several times to loosen it in the barrel while keeping the cover on the needle. The plunger must be pushed in completely after it has been loosened. Apply the tourniquet around the patient's arm 3 to 4 inches above the elbow. The tourniquet should never be tied so tightly that it restricts blood flow in the artery. Next, ask your patient to make a fist.
Can you make a fist for me?
Select the venipuncture site by palpating the antecubital space. Once you've found a vein, use your index finger to trace the path of the vein and judge its depth. Clean the venipuncture site with an alcohol pad. Begin in the center of the area and work outward in a circular pattern. Give the area time to dry before you proceed. Pick up the syringe with your dominant hand. Your thumb should be on top of the syringe and your fingers beneath it. Remove the needle cover. Grasp your patient's arm with your non-dominant hand and anchor the vein. You can do this by gently stretching the skin downward below the venipuncture site. With the bevel up and the needle aligned parallel to the vein, insert the needle quickly and smoothly at a 15-degree angle to the skin. Look for a flash of blood in the hub of the syringe. This tells you that the needle is in the vein. Make sure you don't move the needle after entering the vein. Ask the patient to release his fist.
Okay, release your fist for me.
Now, slowly pull back on the plunger of the syringe with your non-dominant hand. Don't allow more than 1 milliliter of headspace between the blood and the top of the plunger. Fill the barrel of the syringe to the correct volume. Once you have the proper volume of blood in the syringe, release the tourniquet. The tourniquet must be released before you withdraw the needle from the patient's arm. The tourniquet should only remain in place for 1 minute. With your non-dominant hand, place sterile gauze over the puncture site as you withdraw the needle. Apply gentle, firm pressure to the site. Using your dominant hand, immediately activate the needle safety device. Ask your patient to apply direct pressure on the site with the sterile gauze. The patient can elevate his arm, but he shouldn't bend it.
Good. Okay, let's keep your arm elevated.
Remove the syringe safety needle and use the safety transfer device to transfer the blood immediately to the required tubes. Do not push on the syringe plunger during transfer. Doing so can affect the sample quality. When you're finished transferring the blood, throw away the entire syringe unit in the sharps container. Blood begins to clot quickly after collection, so you'll need to invert the vacuum tubes to gently mix the anticoagulant with the blood sample. Inspect the puncture site for bleeding or a hematoma. Apply a hypoallergenic pressure bandage to the site to prevent bleeding or bruising. Properly dispose of any blood-contaminated items, like the gauze and your gloves. Disinfect the work area thoroughly. Remove your lab coat and sanitize your hands. Complete the laboratory requisition form and route it with the specimen to the proper place. Document the procedure in the patient's record.